Coronavirus has wreaked havoc across the world. So far, hundreds of thousands of people have died, millions have been infected. Now, everyone is wondering, when will this pandemic end? Unfortunately, we do not have an answer to this question yet, but reports indicate that unless we have a vaccine, this pandemic will not be over. When will a vaccine be made? That's another question. Well, the timeline looks like 1 year or maybe more than 1 year. The earliest possible date would be the end of 2020. Until then, how can we protect ourselves? What can we do to make sure we do not contract the virus? Well, practice all the measures that have been announced by authorities. Practice social distancing, do not go to crowded areas, wear a face mask, keep your hand sanitized. As long as we take all these precautions, it's highly unlikely that we contract coronavirus. Now, the world is changing. Coronavirus causes many symptoms ranging from sore throat, fever, loss of sense of taste and smell, and also something related to the eye. What is that? Let's discuss this further. Now joining us from Istanbul is Mr. Sinan Göker. He is an eye doctor based in Turkey. Thank you very much for being with us, doctor. You have seen coronavirus over the last few months wreaking havoc across the globe. What I would like to ask you is how coronavirus has affected your work here in Turkey.
Coronavirus actually, as you know, affects the lungs the most seriously. But just like the flu virus, it also affects the eyes, but it's not as important as the lungs or the other serious tissues. So, of course, with the coronavirus and the lockdown, our branch like eyes, ophthalmology, of course, our work is stopped because of the lockdown, because our surgeries, which is my expertise, the laser and the cataract surgery, is not essential. So we stopped doing those operations, but with the easing, so slowly the life went back to normal. So now we also started doing all our operations. People, not as much as before, but maybe 50% were working, and life is coming back slowly.
Yes, life is coming back slowly. Now, as you mentioned, coronavirus mostly affects the lungs, but reports have emerged from some countries that coronavirus is also affecting the eye. It's causing something called conjunctivitis. Can you please help us understand what is it all about?
Of course, I mean, coronavirus comes in the body from the lungs, but then it distributes all the tissues of the body. And just like a flu virus, you know, people get conjunctivitis. I mean, they have watery eyes, the eyes get red and swollen, which is called the conjunctivitis. So just like the flu virus, also in all kind of coronavirus cases, there is some degree of conjunctivitis. But now we know better the situation. It's not there's no transmission through the secretions or tears. It's not the virus doesn't transmit with the tears or the secretions from the eye coming with the conjunctivitis. So conjunctivitis is just like a side effect, we can say. It's not so mainly eyes doesn't get affected very much.
Okay, so is there a treatment for conjunctivitis or not, or does it go away on its own?
It goes away. It goes away on itself. Just like the viruses, there's no treatment in like flu virus also. So just give some symptomatic drops, to get the patient relief. And then when the body takes over the virus, then it goes away.
Okay, now, doctor, you mentioned earlier before we started this interview that in your clinic you perform some sort of your expertise on patients, on about 90% of your patients. What is that all about? Can you please tell our audience?
Yes, this is actually my expertise. It's called cataract and refractive surgery. Refractive surgery means the laser treatment for the myopia and hyperopia. I've been doing the laser for 28 years in Turkey. And the cataract surgery also, the technique called phaco, I've been doing it for 30 years. So the latest trend in these techniques, and it's getting very popular, is to get rid of the reading glasses. We started doing the lens replacement surgery. It's the actual surgery. In the lens replacement surgery, we take the lens, original lens, out and put a new synthetic lens. And the new lenses, the technology improved a lot for the last years. I've been putting this multifocal lenses, which has the multifocus for 13 years. But for the last few years, the technology really advanced. So we do this lens replacement surgery, put a new multifocal lens in the eye. So after the operation, people start to read without glasses and also see distance without glasses, and all their lives. The numbers doesn't come back again, and the patients doesn't have the cataracts, will not need any cataract surgery in the future. Of course, we put the best lenses. So the new for the last maybe 6 months, the best lenses came out. They are called the trifocal lenses. By means of the trifocal lenses, people can read the smallest letters like drug prescriptions without glasses, and they see also the mid distance without glasses, and they see the distance. They can drive a car and do all kind of daily work without glasses all their life. It's a very easy operation, just a 10 minutes operation, even 7 minutes, I can tell. And we do it by drops, just putting anesthetic drops, no pain. So next day, when the patients come to my office, they start to see without glasses, distance, near and mid distance, and the numbers doesn't come back again all their lives.
Wow.
And they don't need any cataract operation in the future. I've been using those lenses for 13 years, but for the last 2-3 years, most of the side effects are settled now. So very, very little side effects, I can say. And patient satisfaction is very high. People get really very happy after these operations. Of course, it's an eye operation. There are some risks, but if a very experienced doctor does the surgery and use the best lens, best quality lens, the next day, when the patients come to the office, they start to see distance and near 100% without glasses, and I can say almost no complication rates, no serious complications we experience.
All right, and now this brings us to the end of another episode of The Brief. We would like to thank once again Mr. Sinan Göker for being with us on this episode. Now, coronavirus pandemic continues to wreak havoc across the world. Unfortunately, so far, hundreds of thousands of people have died. Talking about coronavirus here in Turkey, we have seen some positive developments taking place over the past few weeks. But again, we have to be vigilant. We have to take all the precautions. We have to ensure that we practice social distancing and keep ourselves, our hands sanitized. Now, I know many of you are frustrated with the COVID-19 pandemic. We all want to return back to normalcy. But one thing is certain, there will be a new normal. What used to be normal before the pandemic might not be with us when this virus is over. But this is how the world evolves. There have been many pandemics in the past, but human beings live, and we will live. Hopefully this pandemic will be over soon, sooner than we expect it to be over, and hopefully one day I will get the opportunity to say this. On that note, I'm Jaffar Hasnain. I'll see you with the next episode of The Brief on Thursday.